Hey everyone, glad you all can make it. We have a great speaker today that will be on in just a couple minutes. Jim DeBeaugrine, the an expert in all areas of agency with persons with disabilities. He used to be the agency head, and what seems even more important these days is understanding the complexities of budgets, and was in fact the worked in appropriations for the House at some point and at the Senate at some point. Everyone knows him over there at the legislature. He has credibility. And we are fortunate that Jim DeBeaugrine, even though he retired from government, has stayed very active. He's prior to me coming here, he ran the Arc of Florida for a year. He's the board chair for Family Cafe. He's the board chair for other things involving disabilities. I couldn't even read his resume. We'd use all his time just talking about all those issues. But today he's here for a very important reason to talk about the future with the connection of the federal government and what's called the Access Rule. And it's very important because it's going to impact the entire nation in Florida on how we do our job and how we manage our budgets, especially with regard to our direct support professionals. Um, there's a lot going on at the federal government now with rules and stuff. In fact, currently right now, I'm writing a response to have a category for jobs for direct support professionals, unique to direct support professionals. And I'm giving comment to the federal government on that, how it's so important for recruitment, retaining, and supporting our direct support professionals. They are our lifeblood of the work we do. They are the reasons people can live in the community with services. And I see Jim now. Jim, how are you doing this morning?
Hey, I'm doing good. Can you hear me okay?
Yes, and I just want to say, I've already introduced you. I've already talked about some of your background and stuff. But I did want to say that Jim is a very passionate person about these issues. Most people, when they leave government and they start working in areas like our boards and stuff, they don't take the time to go to national conferences, and they don't stay part of the inside scoop of what's happening in the world of intellectual and developmental disabilities in the home and community-based services waiver. But Jim does, and he's been going to some conferences where they've talked about the access rule. And so if you have a PowerPoint, Jim, we can put it up on the screen. But Jim, just wanted to let you know I appreciate you. I hope I tell you that enough because this is going to be educational about the access rule. So Jim, it's all yours.
Okay.
And if you have questions, you can put it in the chat and we'll make sure that Jim gets to them all.
Okay. Alan, I did prepare a PowerPoint that might be good just to, I just think it might be helpful to keep us organized. Do you want to make it where I can present or?
Yeah, Dina can do that. Can you get closer to your mic, Jim? Let me make sure it's not my.
Sure, sure. Is this
Oh, that's better.
okay? Let me,
Can everyone hear? Okay, Pam, put up your hand if you can hear him good. Okay, Pam says you're a bit you can be heard well. She's our subject matter experts on hearing people.
okay.
Hey,
Uh,
Jim, I just made you the host, so you should be able to share your screen.
okay. Let me do that, and then I'm gonna go here, and I'm going to go right here. All right. Can you all see that?
Yes,
Say CMS access rule.
yes.
Okay, I'll get started. I think I know quite a few of you already, but uh, just by way of quick introduction, I had a 20-year career with the Florida legislature with House Appropriations. Then I left to be the APD director, the third director and the first that actually made it through Senate confirmation. So that was the
You have
accomplishment.
27 old messages.
And then when I left state government, I started my own business, RFJ
All will
Governmental
be answered.
Consultants. And then I also worked with Therapy Services, which is an IT company that many of you guys will recognize. I think some of you are probably customers. Anyway, the CMS access rule has been in the works for several years. I'm going to mention a couple of caveats before I get into this. This rule is a fairly high level kind of rule, and some of the devil's going to be in the details, and we don't have a lot of those details. We will begin to get what CMS calls sub-regulatory guidance and technical assistance starting actually just later this summer and going into 2025 and 2026. Various aspects of this have different effective dates, so I've tried to indicate that in the body of the slide deck. I also have available, I believe I've made this available to Alan. If I haven't, I can make sure to share this. But the National Association of State Directors of Developmental Disability Services, along with several other national policy-oriented advocacy organizations, they have developed a guide self-assessment in cooperation with CMS, a state self-assessment to help them prepare for the rule. And it actually drills down into the weeds a lot more than I'm going to, and it might be helpful for any of you that want to understand some of the finer details of that. So, but I can make, I'll make this slide deck available to anyone that wants it, and I can make that self-assessment available as well. So let me see how I start this thing. All right. I don't exactly know how to start the show, so I'm just going to.
Hey, Jim.
Yeah.
Real quick, since you're the host, you might want to mute. There's a couple people that are not muted.
Okay. How do I do that?
Go up under participants.
Oh, yeah. All right.
Make sure that people are muted so that, and if you could speak just a little bit louder, I think that'd be great.
Okay. Let's see.
Jim, if you click on slideshow, it will take up the whole screen with the slide, and whenever you push the button, it'll go to the next slide. Right up here, slideshow at the top.
Right here, right?
And then press from beginning, and then every time you click it, it will go to the next slide.
Oh, okay, good. Thank you. All right. Yeah, this is much better. All right, so there are several focus areas of the rule. CMS somehow collapses down into 5. I think it makes better sense to make it 6, but it's critical incidents, grievance system, timeliness of access, person-centered planning, quality measures, and payment adequacy and transparency. In almost all of the instances here, this is really requiring states to do things, not so much you guys, with one really huge exception, and that's that last one, which I thought I'd save it till last because that's probably going to be the one that's going to generate most concern and discussion. But real quickly, going into the first area, incident management. It establishes for the first time a national definition of what constitutes a reportable critical incident. This is positive, I think. You know, we don't necessarily have consistency among states today in how they define and address critical incidents. So this is going to establish at least a minimum set of what constitutes critical incidents. States can also add additional criteria that would require an incident to be reported. Real key among these, and Alan, I'm not sure where that noise is coming from. Let me see here. Oops, sorry. All right, it requires an electronic incident management system. And then the incident management system is going to have the ability to aggregate data and show trends. Again, this is probably a good thing. One thing that I believe is going to be probably a little bit difficult to work through is it requires states to cross-check other databases, i.e. Medicaid claims for emergency room visits, the abuse registry, things like that to identify potential unreported critical incidents. And that's one that looks pretty good on paper. I think the implementation here could be a little bit tricky. So we'll see how that lays out. It establishes performance targets and certain reporting requirements. 90% of critical incidents have to be acted upon within state established timelines. States have to do a semi-annual, meaning once every 2 years, assessment of their electronic critical incident management system. This can be extended to once every 5 years if a state is generally in compliance. The effective date for this is July 9th, 2029, and we'll see guidance from CMS starting in late 2025 through 2026, and so that's when we'll have more detail on exactly what CMS is going to expect from states. But it's fairly straightforward as it's written, so I think states can get started on this one pretty easily, and there are a number of states that already deploy a electronic incident management tracking system. This is a brand new one, and some states have this anyway, and managed care programs are already subject to very similar requirements. And this is a grievance system, a formal grievance system where a beneficiary, and that's important. This isn't a 1-800 gripe at us hotline. This is for beneficiaries or their authorized representative to file a grievance against the provider or the state as it relates to either the person-centered plan or the performance of that plan. In other words, this is not meant to substitute for reportable critical incidents, and it's not meant to substitute for the fair hearing requirements that otherwise apply in certain situations. Again, this applies to fee-for-service. There are already similar requirements, as I understand it, for managed care plans. Reports can be submitted either orally or in writing. As you might expect, individuals have to be protected from any kind of retaliation. States must maintain records that include the nature of the grievance, resolution, et cetera, et cetera. The information has to be made available to CMS upon request. That's going to have an effective date of July 9th, 2026, and we'll see additional guidance expected in early 2025. You're going to see July 9th as an effective date on a lot of these, and that's because the rule formally took effect on July 9th, 2024. It was actually filed. It was formally filed back in April, and then it became effective July 9th, 2026. So these effective dates are all keyed off of the initial date that the rule took effect. All right, next one, and I think this is one that's also fairly positive, is it requires states to report on the number of people on the waiting list, but it also requires the state to report the length of time that a new enrollee spent on a waiting list. So not only are states going to have to be transparent about how many people are waiting, they're also going to have to start to compile data on how long new enrollees spent waiting. Now, Florida is capable of doing this, and occasionally you will see that data, but it's not something that is regularly reported upon, to my knowledge, here in Florida. Now, kind of a new twist to this, which I think is really timely and will be most helpful in shining a light on state performance. And this is an issue that we brought up at the Capitol, is that lately, because of the lack of willing providers and their inability to recruit staff, a lot of times getting enrolled on the waiting list does not mean that your life changes in any appreciable way. It's you're enrolled, but then you can't find a service because there's no provider. And there's no provider because rates aren't sufficient to allow the provider to hire staff. And so states are going to be required to report on how long from the time a person was enrolled to when services were authorized, but then from the time that a service is authorized to the person actually receiving the service. Now, this is limited to 4 services. I've got them listed here: personal care, homemaker, home health aid, and what's called habilitation services. Those don't line up with anything we have in Florida by title, but the way this is defined in rule, and this will also be addressed in subsequent guidance, we'll have to crosswalk to which services here in Florida this is going to apply to, but I suspect it'll be personal support, including companion and probably ADT, day treatment type services. It's also going to require the state to report on the percentage of authorized services that are utilized, that actually get utilized for those 4 effective services. Now, once we start to get this data, we're going to start to see, we're going to know a lot more about the state of the service delivery system. So this is probably overall a positive, although there's a little bit of an administrative burden on states. But the good news is Florida already collects the data to report this, so we should be we should be prepared to start reporting on this. Again, it's an effective date of July 9th, 2027. Guidance expected beginning in spring of 2025. There's some, I guess, what you'd call an enhanced oversight of person-centered planning. The rule establishes national performance and reporting requirements. I believe it is already generally a CMS requirement that people receive an annual functional needs assessment and an annual update of their person-centered plan based on the results of that assessment. This is going to require states to start reporting on that, and it's going to impose a performance target that 90% of all beneficiaries receive the functional needs assessment at least annually, and 90% of all beneficiaries receive an updated person-centered plan based on the results of the functional needs assessment. And I didn't put this in the bullet, but these are for people who are continuously enrolled and receiving services for at least 1 year. So for the whole year. So if somebody's enrolls in service and they're only in service for 6 months, they're not counted for purposes of making these calculations, or the state being required to adhere to the performance standards. The effective date of this is, again, this one is another one that's going to be effective roughly 3 years from now, July 9th, 2027, and guidance will start somewhere around late 2025. All right, quality measures set. This is a new one. Well, kind of new. It's going to require states to report on CMS established quality measure set. There's currently a CMS quality measure set that's voluntary for states. These look to me, now this is my impression, to largely be an extension of the national core indicators. And NCI, the core indicators, that started when I was the APD director, and I opted us in, and to my knowledge, I think we're still participating in this. I think CMS is going to take that and make it a formal requirement. They are going to update the existing quality measure set. These are largely, it's largely based on survey data that aims at tracking client experiences, the client satisfaction, things like does the beneficiary feel that their voice was heard in planning? Does their plan reflect their personal priorities? Things like this that are important to track. Qualitative assessments of service effectiveness and how well the system is performing. There is a final quality measure set that will be established by December 31, 2026, and states are going to be required to implement this starting in 2028. So a couple more years on this. And this is the one I think that's probably going to be most directly impact all of you, because it's going to require reporting on your part, and it's going to require you to meet certain targets for effective services. That's personal care, homemaker, home health aid, and habilitation. The same from that we saw from before on the waiting list and timeliness of access provisions. It's going to require states to report on the percentage of Medicaid payments, and in this instance, I maybe should have I should have added a term here, Medicaid HCBS, or Home and Community-Based Services payment, for 4 effective services going to direct support professionals or direct care workers. States are going to have to report on percentage of what they pay that the provider then passes along in the form of compensation to direct care workers. There are provisions in the rule that define who a direct care worker is. There are provisions that define what direct care is not. So there's a little bit of, there are some details laid out in the rule itself, but there's going to be a lot more coming in CMS guidance down the road. Now the biggie, and this is one that I'm going to just candidly tell you all, I don't know how they're going to do this. I don't know how they're going to track it. And I think this one is going to have unintended consequences. And I don't think they'll ever actually implement this, but just understand that notwithstanding my opinion, this is the rule today. This is eventually, you're going to be required to provide at least 80% of the amount you get paid for these 4 effective services. It has to go to compensation for direct care workers. Now, I will say that compensation includes, your Social Security, the Medicare withholding, all those benefits, both optional and mandatory payments that you make over and above actual wages do count. Supervisory personnel do count. But I still think this is going to be a very tough standard for a lot of providers to meet, particularly if services are taking place in some kind of facility setting, which may be the case, particularly for the habilitative services. It does allow the states to establish hardship criteria, which would exempt a provider, and also to create a class of small providers. And small providers can be allowed to meet alternate standards, and if there's a hardship criteria, these providers can be exempted, but it's going to be a temporary exemption. And there is clearly an expectation on the part of CMS that the pool of small providers is going to indeed be a small pool, and that hardship criteria is going to be a temporary rather than a permanent status. So just keep that in mind, that these are not going to be ways that a typical provider is going to escape the requirement to show that at least 80% of what they get paid is passed along to direct care workers. We will start to see state technical assistance and guidance starting early next year through late 2026. There are 2 effective dates associated with these provisions. One is July 9th, 2028 for reporting, and July 9th, 2030 to actually meet the performance standard established here of 80%. This is one where we're gonna need to pay particular attention to guidance that comes out, because I have no earthly idea of how CMS is going to be able to collect and track, or any state, CMS or any state, is going to be able to actually collect the data necessary to make these calculations, unless they're going to be allowed just to do a provider certification, where the provider says, I hereby certify that X percentage of my Medicaid payment went to whatever, went to DSP compensation. So it's either going to be kind of a self-reported thing, or providers, or it's going to be the biggest mess you've ever seen in your life, because you're going to have to start looking at accounting records and things that CMS and a state government they don't possibly have the bandwidth to do this on a provider by provider basis. And this reporting, mind you, and it's reflected in one of the bullets here, this reporting, the data is going to be collected at the individual provider level, and then it'll be aggregated statewide. So this is this one is going to have a very significant and direct impact on all of you. Most of the other provisions, they're going to have an indirect impact on you all, but this one is going to be pretty direct. And with that, Alan and Dina, I'm going to stop sharing. And I don't know if there are questions now would be, I mean, we've got plenty of time to have any kind of discussion, or I can react to any questions if you want to. I guess you could raise your hand and Dina can unmute you. She just took back over being the
Sure,
host.
I'd be glad to.
Okay, and just if I haven't looked at the chat as I've been going, I wanted to get through the presentation
No,
pretty
and I
quickly.
don't, okay, so one question we have, Jim, is what about insurances like workers' comp?
That would be part of, that is part, that will be counted as compensation. It'll apply towards the 80%.
Okay. That was the only question in the chat as of right now.
I've got a question, Jim.
Okay, sure.
I don't know the impact of it, but the U.S. Supreme Court had a ruling called Chevron, which did away with agency and the experts in executive branch government to have a presumption of correctness when there's ambiguity. And do you think that's going to play into this? We've seen in Department of Environmental Protection and other agencies rules being struck down. And with this new ruling, which just got changed within the last 6 months, reversed a 1984 decision, basically taking away a lot of the power from executive agencies. And I know a lot of people think this was overreach by the comments given when they did the rule on the access rule, especially with regard to the 80/20.
Yeah, Alan, I wonder. I chose not to bring that up in
I
my
won't hold you
comments,
to your opinion. I won't hold you to your opinion, but I know you probably thought about it because you see that happening across the board on these rulemakings where ambiguity is determined against the state agencies now.
Yeah, well, let me just say that my background and experience is in Florida government, which we have arguably the most restrictive Administrative Procedures Act in the country. I mean, state agencies can't do anything that is not authorized by a through rulemaking that is not specifically authorized by state law. And agencies cannot expand the impact or the effect of state law. And what I've seen from the federal government over the years, I mean, this is over the decades, I honestly have been quite surprised at what a federal administrative agency, I mean, they essentially are making laws themselves based on, I mean, and there's no particular, there's no real clear, direct statutory authority coming from Congress to do that. I could very easily see that being the case, Alan, and especially for this 80/20 thing. That is just so outside the realm of anything that I've ever read that Congress actually passed. I mean, you can go read Title 19 and the provisions that allow for these home and community-based services waivers, and it doesn't authorize. I mean, it doesn't. It has nothing related to an 80% requirement, and frankly, I think that particular provision, again, this is my opinion, I think it's impractical. I think it's overreach. And Alan, I don't know. I guess the courts will eventually decide, but I hope somebody challenges it, and I wouldn't be surprised if at least that part of the rule gets invalidated. And again,
It's interesting because the Department of Labor rule on overtime has been reversed in Texas with regard to state employees, and that's being litigated around the country too. The January 1st, second increase um, on direct line staff about whether they're managers or supervisors.
Yeah, yeah, I think it's it's overkill, and I'm looking at the chat now. How will companies be paid if they have to pay their employees 80%? It's a good question. I mean, it's a fee for service. So the amount you get paid is the amount you get paid, and you have to make sure that 80% of it goes to direct care, regardless of whether that 20% that's left over is sufficient to pay your overhead. I will say one thing that is not included in compensation is things like employee travel. So if you have a person providing personal supports for several different people, and they travel from one site to another during the day, their travel time's not gonna, or their travel expenses. Let me make sure I'm clear. The wages and all the costs associated with wages are counted, but like their mileage, other expenses incurred transporting the employee are not covered. So this is just going to be a problem. And like I said, I think some of these questions are just, we're going to have to see how CMS proposes to handle them. Again, I think the only thing that I can at least kind of sort of tell what that you don't. I have a pretty good idea of how everything's going to be implemented except for this 80/20. I have no idea on that. I've got another question. If the employee gets a travel stipend, my reading, Kathleen, is my reading again of the rule itself, which is kind of high level, maybe subject to change based on guidance, is that would not be counted.
I got a question. They reference that states have to report the wait list,
Yes.
right? Since we don't have a wait list anymore because they removed that word from the statute and put the word predetermined. I always forget the word,
Pre-enrollment.
the pre-enrollment. Even though the individuals on it feel they're on the wait list, how will that play out, you think, on reporting to the federal government so they can have consistency, so they can see how different states are doing?
Yeah, I don't think it's going to matter what you call it. In fact, I think I hope in the PowerPoint I put in parentheses including pre-enrollment.
Okay, yeah.
I mean, it is what it is. I mean, pre-enrollment, that is effectively people who are who qualify for services, whose family members work and pay taxes in the state of Florida, and they would like service and they're not getting it because their taxes are going to support other people who are getting it. And that's the reality of the situation, no matter what you call it.
Hey, Jim, it's Kathleen. Do you think that's why they made the change to take out the words wait list?
No, Kathleen, if I had to guess, I think, I'm trying to articulate this, but for years now, APD, people in the legislature, and I know some current legislators who are in key positions, when they face criticism about the waiting list, they try to tell people, oh no, a lot of these people are getting services. A lot of these are school age kids. They don't need services. they're not really waiting for services. I think this is more just this is just more. It sounds better. I think they're trying to create a new narrative around the waiting list. That hey, 22,000 people on a waiting list. It's not really as bad as it sounds, because only a handful of those people really need service, and we're taking care of those people. I think that's the narrative that people are trying to create. And I think that's all it is. I think it's just kind of a sleight of hand, um, designed to try to reshape the narrative around what the waiting list is and what it means. And that's where, the advocacy community, I think, just has to gently, politely push back on that narrative, because there are school age children whose families desperately need help beyond what they get through the school system or beyond what they get through EPSDT in the Medicaid state plan. But it is correct that school age children have access to services that an adult who's age 22 or over is not going to have access to. So there is a logic to triaging the waiting list, but the reality is that the needs are there are still needs, and in some instances there are very acute, very urgent needs.
Well, I think the big difference is if you're on the waiver, you're getting the federal match, so it's really good. If they're these few services that are available for people on the wait list is using general revenue, and I heard them talk about this as different pathways, and if they were willing to spend a lot of general revenue to meet those needs, maybe I can understand it, but I haven't seen the pathways yet that would meet those needs yet, but maybe that's their goal.
Yeah, it's again, the name change to me is psychological more than anything else. I see a question from Michelle. Will the state or CMS come up with reporting methodology for 80/20? I think it's probably going to be both, Michelle. I mean, CMS is going to have to tell states exactly what data they want the states to collect in order to determine whether, to calculate the percentage, and then later on to determine compliance with the 80/20. I think this will be driven by CMS, but there could be a fair amount of state discretion once CMS lays out some of the broad criteria. I mean, I'm hoping that at the end of the day that this winds up being a provider self-reported number. Otherwise, I just don't think state government has the bandwidth
Jim,
collect accounting.
Jim, do you know of any other place where they mandate the ratio of staff to administration in state government? I know that they always look at that when they're giving contracts out or they measure, but is there any mandates in Florida law that you're aware of that has something similar to this?
Not that I'm aware of. Back when I worked for the legislature, there were times when we would say administrative expense cannot exceed. And then we would set some percentage, but that was usually something we applied to the state agency. We didn't want the state agency holding back dollars that were intended to be distributed out to providers or community partners. No, this this defeats the purpose of contracting these services out. This is micromanagement to a pretty silly degree. And I'm going to be cautiously. I have no basis for this other than just common sense tells me this is going to be such a train wreck that they're going to abandon it prior to 2030. Or, Alan, like you pointed out, that is a prime target to me of perhaps a challenge based on the recent Chevron ruling. That's my hope, because I don't see how this could possibly be good for the people we serve, and it just that level of micromanagement of private sector business entities is I just don't think is ever justified.
Well, are there any more questions before we wrap it up? First of all, I want to thank everyone for being on. We had over 180 participants, Jim. One of our most viewed. We had a lot more register. I'm not sure how many registered, but a lot of people waiting, and they register so they can see it on YouTube later. But you're the Taylor Swift of people that present for us. I don't know if anyone was dancing while you were talking, but we do appreciate you always coming forward and giving us the first insights into what you think about things that are going on at the national level. And again, we will post this. If anyone wants a certification that they had this course, they can send something to us. And Dina, any last words before I give it to Jim to close us down?
No, but we will send Jim's presentation to all the attendees. And like always, if you need a certification, you'll need to request it. But we'll send out that information later today.
Jim, you get the last word. Any commercial or anything you want to say?
No, just look for my new DVD or my new CD on Spotify, and thanks to everyone for attending. It's always a pleasure to talk with you all, and thank you for what you do.